It's Columbia Morning on KFRU, and as I said a few moments ago, it's been a great opportunity over the last several weeks to be able to talk with Dr. Laura Morris. She's from MU Healthcare. She's an associate professor there with family and community medicine and also works with the COVID-19 vaccine committee. So she is up to date on what's happening with the vaccines and its availability and all the other things we need to do in order to make sure that process runs smoothly. Dr. Morris, good morning. How are you today?
Good morning. I'm doing well.
So let's start with something that we were talking about off the air, and well, I don't think we've talked about this yet. Many more people are getting appointments, and they are have an opportunity to get their shots. I think there's some good advice that you want to share in regard to if you get an appointment and you also then in the meantime get another opportunity to get the shot someplace else, and you're not going to keep an appointment, please let people know. Explain that better than I just did.
Yes. We at MU Healthcare are very appreciative when a patient gets an appointment somewhere else quicker, that they let us know so we can cancel them out of our system and open up that opportunity to someone else. And I think that's the main issue, is that if we think you're coming, we are holding your dose for you. And if you have gotten your vaccine sooner or quicker somewhere else, perhaps at one of the other mass vaccination events, we are not mad at you. We don't blame you, but we want to know so that we can then open that dose up for someone else who is waiting.
If you know ahead of time that you're not going to be keeping that appointment, let the MU Healthcare know, because that way, earlier in the process, it's much more convenient for those who are administering the doses and those also who are on the wait list to know further ahead of time that they're going to have an opportunity to get one because somebody's not going to use it.
Absolutely. And you can actually go on the website the same way that you entered information into our survey to be notified of vaccine appointments. When you click on that banner at the top of our page, there's an option for you to tell us that you need to opt out. And we would really appreciate if folks could do that. Another option is to call our call center at 771-2273. And that will let them remove you from the schedule. But you can do it yourself online just the same way you entered your information in.
Dr. Laura Morris is our guest. We're talking about vaccinations. MU Healthcare is where she works, and we're talking about MU Healthcare with the vaccinations it's able to administer. What numbers are you seeing? How confident are you that you're going to continue to see very good opportunities for people to get their vaccinations?
So I think we're feeling a lot better about the vaccine supply, and we're seeing more consistent and larger distributions. And certainly with the promises from the federal government, right, this is all really a very government-regulated process. And so when the goals from the federal government are to release more vaccine and to move more quickly through this, the state gets more distribution. And with MU Healthcare being one of the high-throughput sites, we are seeing consistent numbers that we know will be able to continue to vaccinate. Of course, we've opened up to more people, and that's the next important step.
Yes, opening up to more people. Let's say that you're not on phase 1, tier 3. So in other words, you're on the next phase or another tier, and you're not on ones that started to become available or, eligible on Monday. Would you still suggest you go ahead and sign up on a register or wait until that particular phase and tier is open?
So we definitely are not advocating that anybody jump the line, so to speak, and we know that with the vaccine supply increasing, we anticipate we'll be able to move a little bit more quickly into the next phases, so phase 2 and phase 3. But it is still important to stay on top of the information and look at what is available. I would say that most places are moving away from that registry or survey type of mode, and MU Healthcare has opened up the scheduling links on our webpage. You still have to attest that as a patient you do indeed meet the criteria in our state guidelines that you're eligible, but you don't have to have your information in our survey to schedule. You can do that when those links come up and the appointments are open. You can do it without us intervening at all.
I have a question for you that a listener sent to me yesterday, and I said I was going to pose it to you. I'm not sure if this is the one that you would be concerned with or not, but this person was in line at a vaccination spot this week, and people around her were from St. Louis. So when those of us in the media report that 23.4% of Boone Countyans have been vaccinated or at least started the process, are we counting vaccinations of Boone Countyans or vaccinations administered in Boone County to anybody wherever they're from?
That particular number reflects the percent of Boone County's population, so folks who live here in Boone County who have initiated vaccination. And of course, with a lot of our vaccines being the Pfizer or Moderna that require 2 doses, that number in particular counts folks who have received 1 dose or 2, and also the folks who have received a Johnson & Johnson vaccine. So even though people from St. Louis maybe are coming to Columbia to get shots, they are counted in their own county. And Boone County is one of the top counties in the state in terms of the number of people in our county who have initiated their vaccine. And some folks from Boone County are getting shots elsewhere, too. So I think there is a bit of mingling across mid-Missouri here.
But when the count is taken, that is accredited to the specific county of residence.
Yes.
Let me ask you this before I let you go. Anything else that's happening with the vaccines that we haven't talked about today that you wanted to let people know about?
Well, we're mostly excited about the opportunity to expand into the Tier 3 and making sure that everyone who's in that tier is aware that they're eligible. I have met and talked with some folks who work in food service, for example, veterinary services. You know, a lot of industries were opened up with this, and it's time to take action. So I think there's been a lot of enthusiasm and a lot of focus on folks who are high-risk medical conditions. They can continue to get vaccinated. No one is leaving them behind as we move on to other tiers, but sort of making sure that folks are looking forward to when they are personally eligible and continuing to push this enthusiasm that we really need more people vaccinated to get to herd immunity and return and stay normal.
And muhealth.org would be a great spot to go to for information about what tiers are available right now and how to set up appointments. muhealth.org would be a good resource. I think I've gone there many times, not only for opportunities to know how to register to get the vaccination, but also information about getting testing, which is still going on and which is still important, even though the drive-thru at Mizzou North has been closed down, at least for now. And that's maybe a good sign that we don't have as many demands for that, although I think it's still important for people to get tested when they need to get tested.
Absolutely. We're blessed that the numbers have gone down, and we hope that that will continue. Vaccination is a huge part of that. Testing is still occurring. It is happening at several sites throughout MU Healthcare. It's just not at the drive-thru. So it's out of the public eye, but not gone.
And again, there'll be estimate for us how many vaccinations would probably be given by MU Healthcare by the end of Sunday this week.
By the end of this week, we plan on another over 4,000 here in the next couple of days altogether, and that will push us up close to 30,000.
Oh, that's pretty neat. I'm glad it's going well. Doctor, I'm glad we get to have these conversations. Thank you. Appreciate your time again today.
You're welcome. Anytime.
That is Dr. Laura Morris from MU Healthcare, our guest at KFRU.